The province making a bold move today by saying most of the safe consumption sites across the province are going to be shut down. The South Riverdale Community Health Centre here is one of those locations. Many on both sides of the argument saying it's a matter of life or death.
Our first priority must always be protecting our communities, especially when it comes to some of our most innocent and vulnerable, our children.
Ontario's health minister laying out new plans to shift the emphasis from supervised drug consumption to treatment, making sure the sites that do exist are at least 200 meters from schools and childcare centres.
We will be introducing new measures to enhance public safety for any remaining sites, including stronger safety and security plans, policies to discourage loitering, improved community engagement, and conflict de-escalation.
Of the 17 provincially regulated consumption sites, there are 10 in Toronto. 5 locations will be impacted directly. It's a move Premier Ford recently said needed to be made.
I'll be very frank, I'm not sold on these safe injection sites that are in neighborhoods that needles are all flown around. It's a haven for drug dealers, in my opinion.
The Ford government will instead spend $378 million to help fund 19 homeless and addiction recovery treatment or HART hubs with support services in Ontario. Existing consumption sites that would otherwise need to shut down by the end of March 2025 will have the opportunity to make the transition. In July of last year, 44-year-old Carolina Hubner-Makarot was killed by a stray bullet when shots were fired near the consumption site on Queen Street East. The community has since been pushing for better regulation surrounding consumption and treatment centres.
The community is very supportive of harm reduction services and supports for people struggling with addiction. We just have to consider everybody else's safety too. It's not an either or, they're not mutually exclusive.
A spokesperson for the South Riverdale Centre responded by saying, "Our focus is on ensuring we have a plan in place for providing continued compassionate care to the clients we serve, support for our dedicated staff, and dialogue with our neighbours." The City of Toronto, meanwhile, and Toronto Public Health have long defended the use of safe consumption sites as a means of preventing overdoses and saving lives.
If sites are forced to close, we will see more public drug use in our parks and in our laneways. We will see more discarded needles on our streets, and we will see more overdoses and deaths.
Minister Jones making a point today of saying that municipalities or organizations will not have the opportunity to open sites in other locations. Those that are being shut down, however, will have the opportunity to apply to become one of the new HART hubs and will need to do so by October. Mark McAllister, City News.